Hello everyone and welcome to the VAIR TISS channel. In this video, I am going to talk about one of the flagship programs of TISS, which is Masters in Hospital Administration. Well, there has been a major change this year, which is that it is accepting CAT and not CUET PG for this particular program. Well, the deadline for CAT has ended, but if you have not signed up for CAT this year and are targeting for this program, even if you are targeting for this program next year, then this video is definitely for you because I am going to discuss all the important points about this program, the eligibility criteria, and also at the end of this video I'm going to discuss about the placement statistics of this program that is currently available in the public domain. So come, let's start. Now a little bit about the program. So Tata Institute of Social Sciences, or TISS, offers a Masters in Hospital Administration. It's a unique program. Well, it aims at developing your leadership and management skills when it comes to specifically the healthcare industry. Well, all of us know that the healthcare industry is a no recession industry क्योंकि इस industry में कभी recession नहीं आ सकता, and we all witnessed it during COVID. Number 3, it also helps with tools and understanding for students to handle complex hospital and healthcare operations. Obviously, the reason why there is a specialized course on this is because the industry इतनी delicate और complex है कि इसके लिए specialized understanding की ज़रूरत है. Now, who is it for? So, number 1, graduates who are interested in healthcare management, hospital operations, and health policies. This is definitely the one for you. Now, if you are thinking I'm a medical professional coming from maybe the Ayush background, or maybe a physiotherapist or an Ayurveda practitioner or homeopathy practitioner, or even if you have done your BSc in nursing or B.Pharm, then that is a relevant medical industry, and this is a good career for you if you're looking to switch to the management and administration side of the same. Number 3, this is also for non-medical professionals. So it's not necessary that you need to come from the medical industry, but if you have a knack, a passion for the healthcare industry, then also you can go for this kind of a course and be closer to the patients, to the industry which serves so many people. What are the key objectives of the program? So number 1, it is to develop leadership in healthcare. A lot of people who are in the medical profession currently are very good with their technical skills with respect to, like, dentists are very good at the dental procedures, or if there are cardiologists, they're very good with the cardiac procedures. But what about the management and administration? We've all experienced long wait times, long discharge wait times, all of this. So in order to take care of this and get these systems aligned, there needs to be a basic system of administration and leadership in this domain as well, which is why these specialized programs have come up to improve the healthcare system. So the patient care is something, the end consumer is not someone who is buying or availing the service because they want to. They're doing it because they have to. So improvement in healthcare system is another thing that they want to do through this program, and that is what they nourish the students to do as well. Number 3 is policy and planning. So obviously at the higher level, there are many things which needs changes. But who are the people who are going to bring the ideas and innovations on board? That's the future leaders of tomorrow. That is you people. So policy and planning. And number 4, very important, is multidisciplinary approach. So healthcare sector in itself is very diverse. So be it the public health sector, the private health sector, the management part, if it is the holistic approach and management, all this is taught to you during this 2-year program. Now, what is the curriculum like and what is the structure of the program specifically? Then the core areas of study is definitely hospital management, HIS, or hospital information systems, because without data, today's healthcare is incomplete, and that's the bloodline of every hospital or healthcare system. Healthcare quality and accreditations. This is very important because quality and standardized healthcare is something which is very important, and our country is moving towards it. So these are the core areas of study, and there's much more. For the detailed curriculum, you can definitely visit their website. Number 2, they believe in practical training. So TISS believes in a lot of compulsory and mandatory internships and field work, which will again yield a lot of hands-on training and give you the opportunity to learn from the best of the best in the industry. And number 3 is capstone projects. So they also believe in a lot of real-time projects, live projects. You're given the opportunity to work on it while you're still a part of the institute and studying. Now, what are the skills that you acquire during the program? So definitely hospital operation management, financial management like resource allocation, budget allocation, very important things in decision making, the human resource management, what kind of employees do you have to get on board, what is the kind of training that you have to give. So the basic domains or specialization of MBA, but again in a specialized for a hospital or healthcare setup. Healthcare analytics, again something which is very trending, that is also covered during the 2-year curriculum here at TISS MHA. Leadership and strategic management, because obviously you have to lead a team and you have to administer everything to get the process in alignment. And problem solving and decision making, again this comes under administration department. So these are the few skills that they train you for. They make sure that they inculcate within you along with the theoretical and practical studies that you are going to pursue. नाउ ये सब तो कर लिया, बट करियर अपॉर्चुनिटीज क्या है? सो ये टॉप 10 करियर अपॉर्चुनिटीज है जो आपको मिल सकती है आफ्टर कंप्लीटिंग योर मास्टर्स इन हॉस्पिटल एडमिनिस्ट्रेशन और द MHA program. Okay, so hospital administrator is one of them, health services manager, quality assurance manager, healthcare policy analyst, clinical research coordinator, public health administrator, healthcare educator, healthcare information manager, patients relations manager. These are a few roles जो कि एक healthcare setup या hospital setup में बहुत important होती है. Moving on to VAIR, तो number 1 इनका flagship program है. Apart from placement, the reputation and expertise, the industry connections it has, because ये program TISS में काफ़ी सालों से चले आ रहा है, as compared to a few institutes which have recently started with this program. So it is very good if you go for a reputed, and the only thing is not credibility, but it's also like the older the institute, the better connections they have with the industry drivers. Experienced faculty, so they have the OG faculties, if you want to call it, because they were the first one in the country to start such a program. So they have on board faculty and from different industries and different areas with different expertise, which will help you learn in a better condition and in a better environment. And holistic learning approach, because they are bringing together the best of both the worlds. It's about theoretical learning as well as practical hands-on learning while you do your internships and fieldworks. Now, these are the placement statistics. If you look at this, the top 10% have got on an average a 13 lakhs per annum package. Top 25% have got a 12 LPA. The median CTC have gone up from 8.3 LPA for the 2019 and 21 batch to 11 LPA for 22-24 batch. The average CTC has also gone on a rise from about 8 LPA in 2019-2021 to about 11 lakhs per annum in 2022-20 for the 2022-2024 batch. So that is about the placement statistics, which is very good for coming for this industry. Now the top recruiters are obviously Sagility, Apollo Medics, Narayana Health, Digit, Tata AIG, Live Long, ABC or Aditya Birla Capital and Life Insurance, Jupiter Hospitals. So these are some of the biggest of big names in this industry. And if you get a chance to work with these and start your career from here, I think it is a great start. Now, what is the admission process and eligibility? Like I told you, I promised you at the beginning of this video, I'm going to discuss about the eligibility and the admission process. So the eligibility criteria is very simple. No mandatory work ex, no mandatory medical field experience required. It is open to freshers and non-medical background people as well. So you can be a graduate from any discipline, and but you should have an interest in hospital administration and the healthcare industry, because passion is obviously important. It drives you to do better and learn more. So you need a 50% score in graduation or an equivalent GPA, which is probably mandatory for all other business schools as well. Now the selection process, so that is firstly you need to appear for the CAT exam. So this year onwards, this program is accepting CAT scores. This is accepting CAT scores for this program. The detailed application form or the DAF needs to be filled in. The selection process could be an extempore or group discussion. This is something that we will come to know closer to the date as we transfer to 2025. Closer to the date, we'll come to know about the same. And of course, a personal interview is definitely going to be mandatory. So if you want to know more about the one-shot selection process at TISS, which is your dream business school, do let us know in the comments below, and we'll sign you up for a free webinar or even free resources, many free resources like mocks, test series, all of these. And if you want to know a lot more about the selection process that we are going to start training all this community members for, you can definitely let us know in the comments below. Now, if you think this video helped you, do not forget to like and subscribe to the channel. All the best.